So today my topics are pneumothorax. So coming to definition of pneumothorax. The definition of pneumothorax is when air filled in space between pleural space and visceral space, visceral pleura inside the chest, then forms a pneumothorax. So the air enters to the visceral cavity. The air enters to the pleural space, the space between the visceral pleura and parietal pleura. The air enters into the pleural space directly by the chest wall or by the rupture in the visceral pleura. So the air which is trapped in the pleura, they exert force on the lungs and they compress the structures. So the main symptoms of the pneumothorax are respiratory distress and acute chest pain. So we have to differentiate the differential features also, differential diagnosis also. So when coming to the cardiovascular, it might be MI, it might be pericardial effusion, it might be the acute pericarditis, it might be acute aortic dissection also. When coming to the pulmonary causes, which causes the same symptoms of acute chest pain and respiratory distress, pulmonary embolism, aspiration, and bacterial viral pneumonia. So when coming to the gastrointestinal, the esophagus spasm is also it makes. So when coming to the structural, the diaphragmatic injuries and reflux also, these are the causes which make the symptoms of the same symptoms such as acute chest pain and respiratory distress. So we're coming to the classification of the pneumothorax. The pneumothorax is classified into traumatic and atraumatic. So when in coming to the atraumatic is divided into primary spontaneous pneumothorax and secondary spontaneous pneumothorax. So the primary spontaneous pneumothorax occurs automatically without any event. So there is no reason, there is no cause. It causes automatically, without any primary event, without any event. Primary spontaneous pneumothorax occurs. When coming to secondary spontaneous pneumothorax, there might be underlying cause before the cause of the secondary spontaneous pneumothorax. And when coming to the normal classification of pneumothorax, it might be classified into simple, where simple pneumothorax doesn't shift the mediastinal structures. When coming to the second tension pneumothorax, it pushes against and shift the pneumothorax structures. It's a critical emergency. So simple pneumothorax, tension pneumothorax, and open pneumothorax, open wound which air moves in and out. It is open pneumothorax. Open pneumothorax, simple pneumothorax, and tension pneumothorax is occurs. So what are the causes of the primary spontaneous pneumothorax occurs without any reason, so without any underlying cause. So what are the etiology of primary spontaneous pneumothorax? It might be the reason of smoking, so tall, thin body, smoking, pregnancy, Marfan syndrome, and familial pneumothorax. Familial pneumothorax हो सकता है next Marfan syndrome, pregnancy, smoking. So these are the primary spontaneous pneumothorax. When coming to the secondary spontaneous pneumothorax, there might be